Good evening and welcome to Information Please, your Peoria Public Library on the air, bringing you information about your library and your community. And this evening my guest is Dr. Spangler, who's going to be presenting a series of programs at Peoria Public Library this winter and spring, and so welcome.
Thank you very much.
I'm really glad you're going to be at the library, and can you tell us what the program is and when it is?
Sure. We're kicking off a wellness series, focusing on helping people to kick off their New Year's resolutions and get healthier. The program will be the second Monday of each month, so at 6 p.m., and then continuing for 5 months after that.
And it's at North Branch,
And
correct?
It's at the North Branch, yes.
And probably in the seminar room, I imagine.
Yes.
Which is the room all the way at the back of the building.
Correct.
So it's a wonderful place to be, and as it gets lighter out, it'll be nice and bright in there.
Sure.
Even at 6 o'clock in the evening.
Definitely.
I guess we're saying that because now it's so dark and cold.
Exactly.
Yeah. Well, tell us a little bit about yourself. How did you get into this? Where are you from?
Sure. Originally from Pekin, graduated Pekin High School in 2001. Always had an interest in going into the medical profession, the health profession. Went to Southern Illinois University Carbondale with a goal of going on to med school. After graduating from there, my decision changed, and I went to chiropractic college in Davenport, Iowa, and was very excited about that and glad that I did that. Mm-hmm. And went from Palmer to Chicago, southwest suburb of Orland Park. Was practicing for about 3.5 years in a Maximize Living office up there. And now my wife Kristen and I decided to move back to Central Illinois and serve the good people of Central Illinois. And so we've been back for about 5 months and working with Dr. Sparks in the Maximize Living Clinic here in Peoria. And very, very excited to be back. So.
Okay. And so tell us a little bit about your vision. What is it that you want to accomplish?
Sure. Definitely in the health industry, there's just a passion to lead people in getting healthier. And, my vision is to influence Central Illinois in order to make a massive shift in the health of people and families. Mm-hmm. And in Peoria here, we are one of the fastest growing clinics, health and wellness clinics, and working with lots of individuals and hundreds of families in the area, and seeing them applying the Maximize Living 5 Essentials and getting truly healthy and building lasting results.
Why do people need professional guidance to do that?
Sure. There's lots of information out there, a lot of fad diets, a lot of programs that claim to be effective, but they're really not safe sometimes. And so we want to be the leaders in the industry, but also for people to cipher through the information in order to get lasting health.
Okay, yeah, I know you can come to the library and check out books on almost everything, and we have, of course, lots of books on wellness, diet, exercise, and so our librarians, the information we also have databases. People can go online and look up various conditions or
Sure.
diseases or wellness things, but it's still a lot of information, and sometimes person to person works a little better. So you've mentioned Maximize Living a few times. What is Maximize Living?
So Maximize Living is a healthcare delivery system. We are working towards changing the way that people view and manage their health through teaching the 5 Essentials. And Maximize Living is the fastest global health and wellness organization. We have, through the 5 Essentials, we're able to lead people, and it's scientifically based in exercise, nutrition, detox protocols, spinal health, and through these 5 Essentials, we're able to stay on the leading edge of the research in order to applying the information that you can gain at the library and start applying that to your life. And then as Maximize Living doctors, we have the ability, or we've accomplished a great goal of becoming Wellness Advisory Council for USA Wrestling, USA Weightlifting, USA Judo, Also working with Colorado Rapids and becoming the official wellness doctors for the NFL alumni just this past year. And so these are great accomplishments, and what that means to you and to the viewers is that not only do we work with Olympic athletes and professional athletes, but we also apply those same protocols, whether it's exercise, nutrition, detox, to them, but also to you as well. So it's the same across the board. Obviously, we would need to tailor it, according to ability, but we are able to impact a large amount of people.
So if you're working with, not you personally, but Maximize Living works with like Olympic athletes, so you must deal with a lot of injuries perhaps, or how does that work with, are they learning things once someone's been injured and you've got to get them back up to where they can perform? How are the different, we all know what a regular doctor does, somebody who's treating the damage after it's been done, but how does a group like Maximize Living working on wellness deal with that?
Great question. And I would say the first and foremost answer to that would be prevention. Maximize Living is all about preparing an athlete, preparing a person to build health in their body and therefore decrease the incidence of injury, decrease the recovery period in which they have to be laying in bed or dealing with an injury. And so whether it's an athlete or a person who's working as a machinist, these types of prevention protocols can actually decrease the healing time and the recovery time. So you can actually expedite their healing.
Yeah, so if you start off healthy, then you're going to bounce back from anything. Okay, who can benefit from Maximize Living? If you follow this program, who's it for?
Great question. The coolest part about Maximize Living and the 5 Essentials is that it applies to everybody and all condition. And not to be cliche, but the reality is whether it's a young person, a child, a newborn, or an adult or a senior, the reality is that the 5 Essentials apply to everyone. And so the best part about working with all types of conditions and all types of people is that we can see any number of changes with health, regardless of where they came from or how long they've been ill or what condition they're dealing with. So, like I said, in Peoria here, we've had the blessing of working with many individuals and hundreds of families, and they're applying the 5 Essentials and getting healthy and well. And so the unfortunate reality, though, as it stands, is just like I said in the article, the World Health Organization has ranked the United States as one of the unhealthiest countries in the world. And out of 37 industrialized countries, it's at the bottom on a regular basis, either 34 out of 37 or 37 out of 37 countries. This is where our health ranks. And so why that's important to me and why my passion is to get people healthy is because we are the most over-medicated population. There's 5 out of 6 people will succumb to a degenerative disease, whether that's heart disease, diabetes, fibromyalgia, multiple sclerosis, cancer, degenerative disc disease. All of these types of illnesses and diseases are it's just an unfortunate thing that these are a reality of most people. And whether it's you yourself personally or a family member, we've all been affected by these degenerative diseases. And 1 in 4 children is on a medication in this country at this time. And so the big problem lies in getting people from their daily life to building health. And so going from their daily life and waiting for an emergency or a crisis situation to happen, who can fill this gap? And that's exactly what Maximize Living and our doctors are trained to do, is to fill that gap, teach people simple daily habits that actually build health over time and can prevent a lot of these crisis and emergency situations from happening.
So why is the United States at the bottom?
Well, I believe that's a complicated answer, and it is a lot of combination of many different things, whether it's food, lack of exercise. When I said food, I meant that we're not eating a lot of fresh fruits and vegetables. We have a lot of processed food, but as I'll talk about later, that and combined with stress and people just not truly knowing where to search and where to go for answers and just trying to piece it all together. And so that's why Maximize Living was created out of necessity to start a massive shift in health care.
Yeah. One of the things that, having worked internationally myself, you would always get to August and all of Europe would be gone because they take the entire month of August off. But on the other hand, then they complain because the United States has more, and so then the theory is, okay, well, we work more, so we have more. But I don't know how that balances out. I'm not real sure how you combat an entire society work ethic and the way we do things, how you do that. I mean, individual people can try and follow these kinds of protocols, but it's very difficult when you can't go out and get something to eat, and so then you've got people who are trapped behind desks and all there is the soda machine, the candy machine. Does Maximize Living do anything to campaign or help people get past those kinds of barriers, just altering your environment?
Yes, and the simple answer to that is by learning the 5 essentials and then applying them with the daily habits. Each of those essentials touch on a different aspect of life. And so the 5 essentials are designed to help people break out of the norm, and what is normal in this country is sick, depressed, battling with weight issues, and really loss of purpose in their life. And so with the 5 essentials, they truly can break out of those patterns with simple steps. And so that again is why Maximize Living was created as a healthcare delivery system.
How long has it been around?
Maximize Living has been around for I think 7 years. The program has been really honed and really just striving to make it a better delivery system, making it easier for people to follow. Very much, if something is too difficult, then people aren't going to follow through. And so Maximize Living has done a phenomenal job of creating simple, systematized protocols that get great results very quickly when people engage. And so that's one of the true things that it makes it more enjoyable for me to work with people, is when they seek out answers and they engage in the 5 essentials. Then that's when true health transformation and life transformation can happen.
Okay. Well, why don't you give us an example? Tell us about an adult that you've seen a change in.
So whether it's headaches, neck pain, back pain, numbness or tingling, a degenerative disease, illness, whatever the symptom is, it's just a warning sign that the body's not healing and functioning at 100%. And so take, for instance, Susan, the name was changed for privacy, of course, but Susan was 53. She had a desk job, was a hard worker, and she was battling with chronic headaches, had the typical neck pain, upper back stress and tension and pain that we hear quite often. And she was also battling with thyroid issues. So she had been taking thyroid medication for about 8 years. After, so this was affecting her life, this was affecting her energy, this was affecting her ability to be as productive as possible as at work, because she would end the day and be exhausted and just want to crash and go to bed. And so many people can relate to that. And so once we, did her consultation, did the evaluation, examined her spine in detail, started working with her, one of the biggest things and the first thing that we start to work with is restoring posture. So correcting posture, having people sitting up straighter and their bodies actually being able to hold themselves up straighter, head over the shoulders, shoulders over the pelvis. This allows the body to work better. And so her posture started to improve. After a few weeks, her neck pain and the aches and pains, the stress started to decrease. She started to have more energy. She was able to finish her day and not be exhausted. And to me, one of the true benefits of what happened to Susan was that not only did she start to smile and was able to enjoy her days better, but also her doctor was able to start lowering her thyroid medication. And so, not that that's what we are treating in her as a thyroid condition or a headache or a neck pain condition, that those are the side benefits of getting healthier. And so when people truly apply the 5 essentials, this is what can happen. I was
going to say, there's a big movement amongst people who work at desks all day to have standing desks. And how do you know much about that, or where people are actually standing so that they can have their spine, their feet, their legs in the correct position and are standing rather than sitting all slumped over?
Exactly.
Do you know much about that or work with that at all?
Yes, we do. There's a very large shift in ergonomics for companies and corporations to be proactive in helping to increase better posture. We know for a fact that posture is a very clear sign of overall health. As you mentioned, people sitting at desks, driving in cars for long hours or many hours a week, sitting on the couch, on the sofa, these things are all very common. The shoulders start to slump forward, our heads start to shift forward, and this posture then creates an environment in the body that doesn't allow health and true expression. So not to get too deep on the library, but when the posture is poor, it is like a window into the overall health of that person. And so, many times corporations are looking to add standing workstations. They're incorporating wellness programs, all of these things. And for example, at a local church, we met a pastor. He was middle-aged, and he was just a very successful, driven pastor. And he was dealing with the muscle tension, the stress, very lack of range of motion in his neck, aches and pains, joint pains throughout the body. And one of his big issues, though, was he was struggling to lose weight. And so he had exercised and tried different diets and things like this. Well, after an evaluating his spine in detail, we were able to start working with him, restoring his posture. Obviously, when posture increases and improves, range of motion then improves, and this then takes the tension off the nerve system and allows the body to heal and function. So his aches and pains started to decrease. He had more energy, and he was a super busy guy. He traveled a lot, and so he wasn't perfect. And we don't expect our patients to be perfect. We just expect that you engage and move towards a healthier lifestyle. Well, anyway, he started to apply the 5 essentials, and he started feeling better, but also he was able to lose weight more quickly, and that was one of his goals that he had when he first met us. And so even if you're very busy and you travel a lot and it's difficult for you to, so to speak, stick to a plan, the 5 essentials are crucial to implementing in your life.
Okay. What about children? They're a very different thing. They're at the whim of their parents. So what does Maximize Living, you talked about whole families coming, but what about children? How can children?
Definitely. So with children, first and foremost, we must start with the parents, teaching them and educating them so that they can make the right decisions in order to put the right food on the plate for him to eat or her to eat. Making sure that they don't just sit and play video games, which is a huge concern of a lot of parents.
Yes.
But as far as children, many times they present in our office not for the typical aches and pains of an adult. It's more along the lines of they hear through a referral or a friend that has had great results that digestive issues with children is very huge, or very prevalent in our office. Asthma, allergies, immune system dysfunctions, chronic colds, ear infections, colic, these types of things. And then also, too, we've seen a lot over the last few years behavioral issues and attention issues. And so all of these issues are affected by just any number of those things. There's all types of causes of those conditions and symptoms. However, again, going back to the 5 essentials, you just apply them simpler to a child, and they work very quickly. And so, for example, Jake, his mom was a patient in our office, was experiencing some good changes and great results, feeling better. And she asked us if we could help Jake, and we said, what was wrong with Jake? And she said that he was constantly sick, okay? And not that he was, in a crisis situation.
Right.
However, most kids miss a day or two of school, every once in a while. Jake, however, would get a cold or a flu, and he would miss 4 or 5 days at a time, so weeks at a time, and this would happen 3 to 4 times a year. So you can imagine being in school, trying to stay up in classes, and missing a month of school. Well, we brought him in, and we got him checked, and we evaluated his spine, and started getting him taken care of and adjusted, and immediately he started to feel differently. He noticed that he was having more energy and just felt better. And the best part about that is that he hasn't missed a day of school in the past 6 months. And so these are the types of changes that happen when you apply the 5 essentials, the principles of health and healing, and they apply at any level or any age group.
Okay. We've talked about the 5 essentials a lot. Do you want to tell us what the 5 essentials are?
Absolutely. The 5 essentials, briefly, are, not in any order, but maximized mind, maximized quality nutrients, maximizing oxygen and lean muscle, minimizing toxicity, and maximizing spine and nerve system.
Okay. Tell me why those different things are important.
Certainly. So, for example, starting with maximizing your mind. This is a huge one, and it's vitally important that a person understands what true health and wellness is and what it's not. True health and wellness is not just the overall feeling good and the absence of symptoms. So once a person understands what true health and wellness is, we can then guide them and direct them with clear-cut path to achieving long-term health. Maximizing your mind also has to deal with emotions. I mean, if you can imagine a person who is constantly dealing with negative emotions throughout their life, whether it's a belief system, anger, bitterness, stressed out, especially this time of year.
Yes.
We see that a lot. People are stressed out about finances, their health even through the holiday season. And so if you don't deal with these emotions properly, not to get too deep, but if you don't deal with these emotions properly, they can actually cause dysfunction and problems in the body. And so Maximize Living has developed a lifestyle management program. It's very simple, it's very effective at helping people to manage their time, get control of their time and manage that effectively and efficiently, and then also just to change their belief system. So for example, if a person believes that they'll never achieve a specific goal, what's the likelihood of them ever achieving that goal?
Well, they won't.
they most likely won't. And so on the flip side, if a person has a positive goal and they take small daily steps towards that positive goal, they can then ensure that they're going to move in the right direction and meet that goal. So it's a positive belief system in that the body can get healthy, no matter what your age, no matter what your condition. The body can heal. To give you an illustration, if I cut my arm, just a little cut, within a few days it will heal. And I don't have to think about that. The body was designed to heal, and so inflammation will happen, cells will be rushed to the area, a scab will form, and then it will be gone, right? And so that same healing potential that the body has is within us all and within every organ. So whether it's heart disease, diabetes, cancer, fibromyalgia, the body can heal. We just have to set the mind and the body on the right course.
Okay. What about, and you're going to talk about these, we should remind people these 5 essentials kind of cover your 5 programs that you're doing, and those are on the second Monday of the month at 6 at North Branch in January, February, March, April, and May. And of course people can find that on our web calendar, which is peoriapubliclibrary.org. That'll be listed in our paper calendar passages every month.
Yes.
But and they can just call the library and say, when is it? 497-2000, and people can get that. But we've only talked about one, and we've got about 3 minutes left. If you could tell me about 2, 3, 4, and 5.
Sure. So maximizing quality nutrition. This is a simple one. It's on most people's minds. We have to eat less processed food. And the more natural food that we can eat, the healthier our bodies will be. And decreasing sugar is a huge part of that as well. Minimizing toxicity. People are aware of toxic chemicals, and we shouldn't just breathe those on a regular basis. But we also shouldn't put toxic chemicals on our skin or in our houses. So we teach people natural cleaners, natural, healthier alternatives to lotions and personal care products. The second or the last essential, which is the maximized nerve supply, is the missing link to healthcare. And the reason why that is because the nerve system controls every other function of the body. So the brain tells every other organ to function, and it sends messages through the spinal cord. And so this is why research shows that if your posture changes and you have that poor posture, that's putting tension and stress on the nerve system and therefore blocking function. And so we help to restore proper posture, take that pressure off the nerve system, and help the body to heal and function. And so when you add in the fifth essential that I talked about, the nerve system, that then makes all of the other essentials more effective, that much more effective.
So do you do that with people through exercises, how do you get people's spines back where they need to go? I mean, when people are in the habit of sitting at a desk all day, how do you get them to think about their posture and the way they're sitting? Or for example, you wear trifocals. So sometimes it's almost impossible to see, and you're just constantly struggling trying to just see. So you're not sitting very properly.
It's through a very scientific and cutting-edge protocol called spinal correction. We do advanced spinal rehab in our office that helps to restore that proper posture and then helps the body helps train the body and the muscles to keep yourself upright and in that proper posture.
Great. Okay, well, we're out of time, but thank you for coming.
Yes.
If you're interested in learning about maximized living and improving your health through this wellness program, those programs are at North Branch, and you can find that on our web calendar again or call. And we'll see you next week on Information Please.